Hello everybody, I am Dr. Siddhesh Dhaygude. I am consulting nephrologist working in this field since 2006. Today we will have discussion about dialysis. See, dialysis is a modality in which once the patient develops kidney failure and his kidneys are not working properly and total function is less than 15 ml per minute, what we call it as glomerular filtration rate, usually patient requires dialysis. One of the myths in the patients is that there is certain creatinine level or urea level beyond which patient requires dialysis. It's not that so. Dialysis is decided according to the clinical status of the patient. How is he eating? Is there any nausea? Is there any vomiting? How is his appetite? Is there any swelling over the body? What is the potassium level in the blood? And what is the acid-base status of the blood? All these factors as well as the fluid status of the body will decide about the dialysis and not just the creatinine or urea value. Once patient requires dialysis, another myth in the patient is that once it is started, it cannot be stopped. It's not so. Usually, in a chronic kidney disease or chronic renal failure patients, those patients in whom kidney are unlikely to recover, patient will require dialysis lifelong. Those patients having temporary kidney failure will recover out of the kidney failure and dialysis can be stopped. It is just the replacement of the kidney function by a machine or external agency with artificial kidney is called dialysis. Dialysis is of two types: hemodialysis that we do in the hospital using a machine and filtering blood through an artificial kidney and a circuit. It is called hemodialysis. It is done 3 times a week. And peritoneal dialysis, in which a fluid is instilled inside the abdomen through a soft tube implanted in the abdominal cavity. It is done at home, maybe manually or with the help of the machine. It's called peritoneal dialysis. For hemodialysis, we have to have a vascular access. In case of emergency situation, we start the hemodialysis by putting a soft tube either in the neck or in the thigh called catheter, and we start hemodialysis. For long-term dialysis, we prefer to have either AV fistula or subcutaneous tunnel catheter or AV graft. AV fistula is the best type of the vascular access for a long-term hemodialysis. What do you mean by AV fistula? You join two vessels of the arm either at the wrist or over the elbow, that is artery and vein, through which the blood is short-circuited and the vein becomes of larger size and blood flow through the vein increases, giving adequate blood flow for dialysis. This fistula takes around 6 weeks for maturation, after which we can use it for the dialysis purpose. In case of an emergency, we use the catheter. Catheters have their own problems. They can have infection. While putting the catheter, they can have some bleeding. There can be sometimes injury to the internal organs. So we always prefer for a chronic kidney disease patient to start dialysis on a vascular access, that is AV fistula. So whenever there is a loss of kidney function less than 30 to 25 ml per minute, we usually advocate patient to get an AV fistula done well before we require a dialysis. It's not that once you prepare the AV fistula, it is must to go for dialysis. Dialysis can be prolonged till clinical status allows a nephrologist to do so. AV fistula has the minimum chances of getting infection and it provides good quality of dialysis. Dialysis is a life-saving measure for a kidney disease patient. Dialysis is not a modality to be replaced for lifelong, and ideal modality will be a kidney transplant in those patients who have a permanent kidney injury or kidney failure. Those patients who require temporary dialysis, they don't require kidney transplant for a replacement of the kidney function. However, which type of a modality to choose will depend on various factors, that is availability of that modality nearby the patient's house. Second thing, finances that are required in over a period of time, expertise that is available, comorbid conditions of the patients like diabetes, hypertension, heart disease, blood vessel status that don't allow sometimes to create an AV fistula. These are all modalities are taken into consideration before we choose the modality. In India at least, hemodialysis is little cheaper than peritoneal dialysis, as it is provided by various societies as well as some organizations do dialysis in concessional rate. Hence, the hemodialysis is provided at the cheaper rate in India compared to peritoneal dialysis. However, recent studies have shown that peritoneal dialysis in private hospital setting is comparable to the hemodialysis. Hence, we can choose either modality depending on the patient's need, patient's choice as well as his comorbid conditions. Thank you.